Hello, world. I am Katie Walker. I am the CEO and founder of a company called Revitalist Lifestyle and Wellness. My background is I've been a nurse for almost 20 years. I've got an advanced degree in anesthesia. It's about a little over 10 years old. And then I have another one in psychiatry. And one of my strengths is I opened Revitalist in 2018, and I have been now in about 12,000 ketamine infusions, and it's allowed me to see more specifically from a neurologic standpoint what the brain's doing, and it's pretty consistent. So today we're going to talk about this neurologic theory and how it may affect our adolescents and our young adults. Because right now we're not giving our adolescents and young adults the care that they need, not because we don't want to, because we don't know how to. And ketamine is allowing us to see that. And eventually psychedelics, as they come to the surface, they'll allow us to see that as well. So there's a lot of hope for the future, but ketamine is real time. It's real-time intervention, allowing us to literally help save the lives of our adolescents and our young adults. So with adolescents and young adults, we blame generations, we blame screen time. We want them more nature versus nurture versus nature. We want them outside more. We want them to read more. Like, we have all these different interventions. But my personal opinion is we're training our kids' brains to work at speeds that they don't have the hardware to know how to stop. So there's so much data coming to them, whether that is through social media platforms, the TV, school, friends, sports. There's so much data coming into them. It gets mixed together. Nothing wrong with our kids, but more so that they just don't know how to categorize and effectively prioritize those different thought processes. And when that happens, when they start losing that ability to feel like they can categorize and prioritize things, then things start getting kind of mushed together. And that mushed together creates all kinds of stuff, just a negative cascade. So that negative cascade is typically control. You'll see your kids start to not trust themselves. They'll start to doubt themselves. They look at you or their friends as having more of the controlling powers with decision making, which is unfortunate because sometimes those decisions aren't always the best, especially if it's the friends who we may not think have the best influence on our kids. But over time, this creates a cycle of instability to where we'll then see our kids start having symptoms of anxiety and depression, insomnia. They don't feel like they can drop it. They're ruminating all the time. You see their grades start to decrease. And then once a very high functioning student, they then can start consuming alcohol, drugs, sex, different pieces, right? They're coping the best that they know how to cope. And it's not a conscious coping, it's a subconscious coping. So they're trying to actually address some of those symptoms and they don't know why. So as a parent, when you go, why are you doing this? Your kid goes, I don't know. And you're like, sure, they don't know. Like, they really don't, they don't have the capacity, right? Their mental health skills are not there yet. They do not have these third person introspective analytical views on their actions like we're supposed to have as adults because their little brains haven't been trained to do so. Only thing that we're doing to our kids is we're just forcing almost all this data into their brains, and we're just like expecting it to work, but nobody's looking at those networks, seeing like, well, how is it working? Why is it not? Oh, they must have ADHD. That's right. Let's say they have ADD. Let's say they have ADHD. Let's put them on Ritalin. Let's put them on a stimulant because their brain's already stimulated, right? And then we expect they're going to do so much better. And sometimes they do, right? But we're not solving the issue. We're meeting it, right? So their brain's up here functioning and they don't know what to do with it, right? Because they just don't have the skill set to drop the ADHD or the ADD capacities. So instead, we're going to medicate them with a stimulant up here, and that way they can learn to keep up with themselves more effectively. No, it's wrong. And then what happens? Look at Ritalin. Look at all the things that we put kids on. We're creating addiction to these kids when we put them on substances because they don't know what to do. And then we say, oh, they're mentally ill. Oh, it's in their family. Their family is mentally ill, so they're mentally ill too. Just because it's in your family, you may have a higher level of genetic predisposition, does not mean your kids are going to get sick. We have much more control over our brain than what we know. But it's the skill sets that we lack on how to control our brain. So instead, we give medications to suppress it. Don't give medications to suppress your brain. Our brains can't be suppressed. It's going to fight against it the whole time. Instead, we have these beautiful things called ketamine infusions now that allow us to disconnect from what our brain's doing on a day-to-day capacity, and we can analyze it. And your kids, your adolescents, and your young adults, from what I've seen, they have such a high level of intelligence, and they have no idea what to do with it. And we're not guiding them the appropriate way for them to learn the structural capacity of how to deal with their intelligence levels. Instead, we look at them like they're abnormal, right? And then we create this sense of shame or, to where they should decrease their productivity. And it just makes no sense. So I'll tell the kids, when they come in, it's like your software is up here, your hardware is here. And what ketamine infusions do is it allows that structural piece of our networks to actually start increasing hardware to where our hardware makes our software, right? Not that we're giving our kids cocaine to say, well, I hope it helps your ADHD. Instead, we're teaching them, we're increasing the structural components with the emotional components to where they can align. Once they align, they integrate. That's when you see your kid regain their control of themselves because they have that ability. They're just way too smart for what structures we're giving them. So, these three pieces, your parent, you've got kids that are out there that are extremely smart. You don't know what to do with them. You don't want to take them to the ER. What do we tell you? Take them to the ER. They'll get them committed. Then take them to an inpatient, right? What happens with inpatient? Why don't we ask our kids how many kids, did it save their life? Sure. How many kids were traumatized by going to an inpatient psychiatric unit? Have you asked your children that? So great, we saved their life, but we just re-traumatized our kids because their brain was over functioning and we didn't know what to do to tell them how to stop it. So what we're seeing with ketamine is allowing these three networks to start coexisting and to be strengthened. So your salience network, if your kid's ruminating, if your kid can't drop it, if you say, just drop it, and they keep coming to you and they will not drop it. Sometimes that's stubbornness. Other times that is, they literally can't drop it. They don't have that skill set. So it's rumination. Rumination is a thought that loops and loops and loops, and I can't get off my mind. I can't get off my mind. So how do you break rumination, right? So I tell kids this all the time. Rumination's abstract. It's just a thought, right? There's nothing tangible about a ruminating thought. So one thing I'll tell kids, because they're like, I don't know how to break it, right? It's a skill set. They don't know how to break it. So if they don't break it, what happens? Rumination gets worse because the brain duplicates what it knows. So I'll tell people, kids, whomever, you get something on your mind and it's abstract, it's a ruminating thought. Learn how to break an abstract thought. And the way that you break that is you look at something that's more concrete. So people who have panic attacks, that's abstract. You actually can get them to break a panic attack by doing simple math problems. 1 + 2 is 3. 3 + 2 is 5. So your kid's like, you're like, 1 + 1 is what? And if you can actually get them, their brain, right? So it's right, left brain, you're getting their brain to actually start thinking about more concentric items. You can break it. If your kid's like, I can't do it. Literally, they don't have the structural capacity to. So I'll tell kids too, if you're having a ruminating thought, so doing little math problems, to look at something, grab an object that has no emotional capacities, right? Marker. And I'll tell them, look at the marker, right? Why is it black? Why did they put think about if you were the engineer, think about why they made this marker exactly like they did and really get into it, right? So if I was sitting here having a ruminating thought and I was like, all right, got to get this off my mind. I don't know how to, I want to look at this marker. So you look at the marker and you look at it as, okay, well, it says pro clean. I wonder why they would make it more italic, make that bold. Why would this one not be bold? Why did they make the marker this high? And then, why did they make it this big of a tip and, not a little tip, but, why would they do all that? So if your kid can think about something completely different and get the thought off their mind. And they're strengthening the structure of their salience network. The issue is our kids can't do that. So when you ask your kid, are you sleeping at night? Can you stop your mind from going? And they say no, your child's at a higher risk of hurting themselves. And that needs to be addressed. So is it therapy? So what is therapy? What is coaching? What is guiding? Therapy is more processing. So does your kid need to process why they can't get things off their mind? Sometimes, sometimes it is a processing piece to where, maybe if they understood the situation more, they could drop it. But sometimes it's a coaching piece to where they don't know how to get it off their mind. So they can learn different tricks like looking at concentric objects, different things like that. So they can start retraining their mind because their mind can be retrained. That's the beautiful piece about ketamine. Ketamine is an acute intervention for an acute situation. So when your kid starts having suicidal thoughts, and they probably don't want to tell you because they don't want you to think they're crazy. But when they have suicidal thoughts, a lot of times it's because they feel completely out of control of something and their brain is actually meeting that polarity. So I'll tell people like Newton's laws of physics, to every action, there's equal and opposite reaction. So if you feel completely out of control, your brain's going to match that with feeling completely in control. Should your kid have suicidal thoughts, which it seems that a lot are right now, they're trying to actually control the situation that they feel out of control of. So their brain's functioning normally based on a scientific perspective. But what we do is we'll take our kids to the ER. They'll give them Valium or Haldol, or they'll give them medications that start working in about 6 weeks. They actually have a black box warning on them that show you that they actually increase the suicide aspect sometimes. When in reality, we have a medical intervention called ketamine infusions that's acute. It's an acute intervention that addresses an acute situation. You give one infusion and it breaks suicidality up to 98% of the time. That infusion is 40 minutes long. They're usually there about an hour and a half. You need a provider who knows what they're doing, not one that does an IV push, not one that has your kid in an overstimulating environment. It needs to be in a calming, enriched environment with the right people who can neurologically, psychologically, anatomically, physiologically look at the brain. Because ketamine changes all of that. And a lot of times it gives your kid back. So you may break this acute piece. You may get your kid back, but then your kid gets re-triggered again. And that's because the structures aren't there yet. So the more that we can identify these neurologic structures instead of thinking that they're just emotional creatures, the better off we all are. So we're all emotional creatures. We all have an objective nature as well, right? But we want those to be balanced. Objectivity, subjectivity, physical, emotional, all the same thing. Should your child or young adult come to you more emotionally, consistently, they've not processed something and they're struggling. So if you have an angry child, rageful child, sad child, crying child, is it hormones? Sure. But if it's a consistent piece to where you're seeing this, something's going on with your kid's brain. So I'll tell people, you got your frontal lobe, you got your processing center, which is more so your amygdala, and then you have your occipital lobe, which is your long-term memory. Frontal lobe, short-term memory, personality, emotions are attached to the short-term memories. So what is that? That's rumination. It's a thought I just can't get off my head, and they've got an emotional capacity to it, right? It's in there, it's stuck. It's literally stuck in the frontal lobe. It can't get to the processing center. So what ketamine allows, it allows that physical and the objective to disconnect. When it disconnects, the brain's able to analyze the emotional piece, the subjectiveness. When it analyzes that, it's able to go to the amygdala processing center and gets processed to your long-term memory. In your long-term memory, emotions are not connected. And they're not leading the memory. Your memory is objective. So So you can talk about something, you get your calm child back, and the child can bring the emotion should they want to bring the emotion, but they're not being led by the emotion. So do we have hormonal pieces that come up all the time? Absolutely. Especially kids, right? They're changing all the time. But it's something that we can objectively help identify, and we can look at the neurologic components. So Salience network, beautiful piece to look into. Lots of data, lots of science, especially if you like to read that stuff. Central executive network. What's the data that comes in? How are we interpreting the data? What are we doing with the data? Is it being misinterpreted? How are we actually implementing the data into our everyday lives? Because it's not just because your serotonin's off and your dopamine's off. We've not taught our kids to think. We've not been taught to think. We just expect the brain's going to think and everybody's going to do the right thing. And we're going to blame it on their IQ. Maybe their IQ is too low or too high, but no, we've got to learn when you interpret data, are you interpreting it correctly? And are you deploying that information correctly? Because sometimes it just gets off track, right? And then we just start giving them more serotonin to make them feel better about themselves. No, their data is still off track. So Central Executive Network, great thing to look into. Default mode network. That's a big one. Default mode network can be positive. It can be negative. If you're around people who are negative all the time, they may have a negative default mode network. Your people who develop addictions, this is something with kids that we need to look into specifically too. My personal opinion with addictions is it's an emotion that gets attached. It's a suppressed emotion that gets attached to an object, right? So if you talk to people with addictions, they're not wired differently, but they'll say, oh, do you remember the first time you hit cocaine, first time you took Lortab, first time you took that drink? You remember that? Yeah, you're wired like an addict. And I personally think that is so ethically wrong to tell someone. I personally believe it's when the emotion got connected to the object and the brain can't differentiate. So our brain knows how to help us to survive. Our brain does not know right from wrong, good from bad. And when we get connected to an object instead of to the people, that becomes our safety. The brain duplicates what it knows, so that addiction gets stronger with the object, and we start disconnecting, but we realize it's wrong, right? But we don't know what to do about it. But we keep staying connected to that object, and our addiction keeps getting stronger. So when I say our brain duplicates what it knows, parents of athletes, right, or whomever, musicians, skills, right? We always think that everybody believes in muscle memory, universal language, muscle memory. And believe it or not, our muscles don't have memory. It's our brain that helps to control the muscle piece. Our brain also has behavioral memory. So if we don't address what caused the conflict in the first place, it could be anything really. It needs to be something our brain just doesn't understand. Then it creates conflict. And that conflict, if we look at Newton's laws of physics, every action has an equal and opposite reaction. That conflict will sometimes within 6 months start creating symptoms of anxiety and depression. And with anxiety and depression, we'll see the duplication cycle start if we don't address what caused the conflict. So we can go to talk therapy forever and keep bringing up the same thing. But it's not conscious what our brain held on to. It's the subconscious component of what our brain held on to. And we don't know what our subconscious does. Our subconscious is stupid, simple, strong. Our conscious is weak. It's able to analyze, but it's weak. And it doesn't expect to, our conscious doesn't react during situations that catch us off guard. It's our subconscious. So what happens, what I see a lot of times in kids, adolescents, young adults, we hit conflict. What is conflict? It could be a negative statement that was said to a kid in 4th or 5th grade. It could be that they got raped. It could be that they gained weight. It could be anything, right? This knocks them off track. A lot of times I see when they go from like middle school or like elementary school to middle school to high school to college, you see that piece too. That's the conflict. So it's almost like a change in their base. And then if that change in their base doesn't get addressed effectively within 6 months, then they go to the polarities, which is kind of your Newton's laws of physics, right? To where anxiety and depression live in the same space, even though they're complete opposites. And then when we start trying to get treatment for anxiety and depression, we have to go to 2 separate lines of medications that are completely opposite in order to try to create that neutral effect that we're going for. But in reality, it's because their brain's at polarities. So if we don't get this addressed over time, anxiety and depression, and figure out that neutralization part with the integration piece, then the brain will duplicate what it knows. And what happens is then we get to see these levels of, and this is my personal opinion, my personal theory of brain illness, is you have anxiety and depression. You got cycling, right, of your moods, because we all cycle. But you have anxiety, depression, and then over time it duplicates what it knows. Then you get bipolar 2, bipolar 1, schizoaffective, schizophrenia, and then finally at the end you have paranoid schizophrenics. But the neat thing with ketamine and psychedelics, it's taken the brain into a neutral space to where it gets to disconnect from these. So we've actually seen people be able to come back, and it reverses a lot of the damage that we're seeing from a neurologic capacity. So with this piece, it's my theory, and I think that it's got a lot of legitimacy to it. But what you have to be careful about with ketamine specifically is this is a level of increased in abstractness. So if you understand bipolar 2, it's more of a reactive anxiety and depression. Bipolar 1, it's anxiety and depression reactive, but then they also have a little bit of an abstract piece called mania that can occur to where they're not sleeping, they're not thinking correctly, they're kind of in this thought world that's not, is it real, is it not, is it delusions, right? And they have schizoaffective, to where they can't really differentiate their abstract thoughts with reality. And then schizophrenia occurs to where it's much more abstract, right? They're kind of living in their own world, but that's their world. It's where their brain went to because it's safer there. So it thinks. And then your paranoid schizos, right? Those are the worst of the worst, because they're really, really struggling and they don't trust anything. So if you look at these pieces and you keep Newton's laws of physics in your mind, action equals, reaction has an equal and opposite reaction, then you get to look at kind of what I was talking about a little bit, but like when I was talking to you about your kids, right, with trust versus paranoia, these are opposites of each other, trust and paranoia. So if your kid gets to the point to where they can't trust themselves and they start putting their trust onto someone else, then they start getting paranoid, and you'll see these coexist at the same time. But ketamine allows your brain to get into this neutral piece right here, to where your child can effectively analyze what is trust. And we can help them with that, by golly. As adults, we can help them to look up descriptors of what trust is, or paranoia, right? That's probably better for us instead of telling them they're chemically imbalanced. But if they're able to get to this neutral space and analyze trust and paranoia, they're able to analyze, I'm feeling out of control versus feeling in control, or abstract versus concrete, or fear versus love. Once we can analyze each of these effectively, then you can incorporate those polarities to where you can find that neutral piece. The neutral piece is meditation. It's not feeling anxiety, not feeling depression. It's being in a meditative state to where you're truly in the present and you're not connected to anything, just peace. So our present is supposed to be nothing but peace, but we'll go over that in a second. So when your kid has suicidal thoughts, they feel out of control and their brain's matching that polarity with saying, I can get you in control if you kill yourself. So I always tell kids, I try to get them comfortable first to tell me, you've had thoughts of not waking up, right? Or, a lot of them may have plans. Unfortunately, a lot of kids hang themselves. So it's all unfortunate, right? But if they even have the ability to be like, yeah, I'm like, I'm not going to put you in a cell to protect yourself. Let's learn how to train your brain to say, no, that's not really effective, is it? Because I tell them, too, like, if you kill yourself, who's to say that you're not living in the same hell that you were trying to leave? And I've never talked to anybody who's killed themselves and effectively asked a lot of questions. But so with that piece, if your child has thoughts of suicide, it's because they feel out of control in some capacity of something. So you want to try to talk to them and be like, all right, why do you feel out of control? Sometimes it's because you put them on a new medication and they're putting all their control on that medication to make them feel better. Well, then when they don't feel better, then they feel out of control because what they put their control onto didn't match, right? It didn't match together. So that's when they get to this piece and it's like, it's just not good, right? So kids are walking around blind and we're just putting them on long-term medications that change their entire neurologic landscape. So antidepressants aren't supposed to be taken for greater than 90 days from the data that was actually proposed with the scientific aspects. How many people have been on them for 10, 20, 30, 40 years? We're all taught as medical prescribers to put somebody on something, but how do you take them off? That's why ketamine is so amazing. You don't take it every day. You do an intervention, you train the brain, you get the brain on track. The brain knows how to fix itself. We just got to put it in the right capacity to do so. So here's where you want your kid in the present. Here's where we want ourselves is in the present. You're a ninja, you're sitting, legs crossed, eyes closed. You look like you're not paying attention, and I throw a baseball at you and you catch it. That person's truly in the present. Not connected to anything, but they can react to everything if they choose so, because they're truly in the present moment. That's what ketamine allows our brain to do. It puts our brain in a meditative state to where it's in the present moment. It disconnects your kid from anxiety, depression, insomnia, suicidality, trauma. It disconnects them from it. It like breaks that circuit. When it breaks that circuit, your child gets the ability to step back, hear effective communication from a provider or a therapist or whomever, and actually start to integrate those tools. Because otherwise you're like, my kid's not listening to me. You're right, because they can't. They're in survival mode. You're running from a bear. Katie tells you, hey, stop and smell the flowers. I need you to smell the flowers because the bear's coming after you. It's fine. Smell the flowers. You can't smell the flower. You may stop and smell the flowers, but you're not going to truly smell the flowers. You're running from the bear. Our kids are trying to survive right now because the system that we have is not working. The advice that we're giving these kids is bad advice, and they lose hope. And when they go to kill themselves, it's not typically because they hate themselves. It's an anxiety component telling them to get out of the situation. And that's all they know to do. They want to run away from it. So when they kill themselves, that's how they get away from it. And it's unfortunate because we're losing some of our strongest kids out there, because most people who struggle with mental health issues are extremely intelligent, but their software is greater than their hardware. And it doesn't understand the structural component of each. So when this happens, when your kid has these suicidal thoughts, don't think your kid's mentally ill. Think your kid has no idea what to do with their brain. And that we want to help them. We want to train them. We want to teach them, right, as to what to do. So here's your kid in the present. So what happens? A lot of times we take past experiences and we put them on the present. That's your trigger. That's when your kid reacts. That's when your kid just can't get off their brain because something happened 5 years ago. It happened 5 years ago. Just let it go. They can't. Their brain held on to it. It's not them. Consciously, they're trying not to, but your subconscious is way stronger, right? Stupid, simple, strong subconscious. And it's like, no, I need to protect you now. And your kid is trying to disconnect it, but they have no idea how. So when ketamine disconnects that for them, and we give them these training strategies, then once it comes up again, they're actually able to be like, oh my gosh, I actually did an intervention and it worked. So the other things that our kids do, unfortunately, school, we like to put a lot of pressure on them with that as well. But they'll take the past, and with the past, they'll prepare for the future from what they learned. So what they learned from the past is to prepare for the future. They completely forget about the present. So if you're having anxiety, you're living in the future. If you're having depression, you're living in the past. If you're truly in a meditative state, which is living truly in the present moment, you do not have symptoms of anxiety, depression, suicidality, obsessive compulsive disorder. You don't have any of those. You're just in the present. And you can breathe, and you can smell the flowers. And if there's a bear going to run at you, you're going to be able to react to it. But you don't have to constantly think there's going to be a bear. That's anxiety. It's controlling your life. So if you feel like you're having emotions control the objectiveness, that's when you need to get help. So how does ketamine work, especially on our kiddos? Like I said, it disconnects the brain, allows the brain to get, it's kind of a breathing room for that. But ketamine also crosses. So we give it IV typically. You can give it IM. There's also oral that's out there. The levels of different absorption depending on the route. But when you give it IV, it's absorbed on a cellular route. So the smallest dose, highest absorption, and it crosses the blood-brain barrier, which a lot of our medications do not do. So blood-brain barrier, it's kind of an area around your brain, helps to keep the brain sterile. So ketamine actually crosses the blood-brain barrier. So when it crosses the blood-brain barrier, we have receptors in our brain that allow these medications to work. So ketamine will partially antagonize some of these receptors called your NMDA receptors, not to be confused with MDMA, but NMDA is your glutamate receptors. So ketamine partially antagonizes them, right? So it comes in for a little bit, doesn't stay forever, and then it gets off. That's what partial antagonism is. So it comes in, the brain says, oh crap, I don't have enough glutamate because my glutamate's blocked. Ketamine allows the brain to have an organic process to where it starts producing glutamate. Glutamate we can't take. You can't take it IV. It doesn't cross the blood-brain barrier, so it doesn't have a direct benefit to our brain. Ketamine tricks the brain into producing more glutamate internally, and that glutamate is the mother communicator of all of our cells in our brain. Communicates to over 90% of our brain cells. So glutamate creates a chain reaction, causes something called BDNF to be produced, brain-derived neurotrophic factors. And when BDNF gets produced, it makes new pathways in our brain. These new pathways are healthy pathways. They're not damaged by the depression, anxiety, trauma. So we're seeing people who live with a lot of mental health issues. They have cerebral inflammation, so their brain's kind of swollen to a point. And when it duplicates these pathways, much like our cellular turnover, right? Everything's constantly getting turned over in our body. Good, bad, ugly. It's just getting turned over. So when these pieces in our brain get duplicated over time, some of them are more damaged than others. Sometimes the communication pathways or the new growths on some of these neurotransmitters they're called dendrites. Sometimes they're damaged. And you can see it. You can see the damage. So, right. So as we get older in life, we get something called brain atrophy. Our brain actually gets smaller over time. So hopefully the goal with ketamine is that our brain won't get smaller over time because it causes pro-circuitry, because there's an increase in the networks. And so if we're able to increase these networks, we're able to use our conscious ability to analyze from a third party what our brain's doing to where we can build the structures. And we can actually say, no, when I tell you this, I didn't mean that, I meant this. Oh, kind of piece to where everybody starts getting on the same path of interpretation and processing and deployment and how do we execute different things in their brain instead of just saying, you're not thinking right. I bet it's your dopamine. Why don't we just try to change the thought process of how we handle the brain? And why don't we look at our children, right? So our kids between the ages of 10 to 14, their second leading cause of death is suicide. It's horrible, horrible. And we don't know what to do about it except to prevent suicide. Don't prevent suicide. Go to the very front to where you're preventing anxiety and depression to prevent suicide. Don't wait until your kid's got a knife. Go into where you can see your kids not effectively categorizing and prioritizing topics and their grades are starting to decrease and their sleeping starting to change. That's how you prevent suicide. You don't wait until they're partially dead anyway and take them to the ER. You just don't. And if your kid's completely fine and all of a sudden they have a suicidal thought, it's because they feel out of control. It's an ineffective coping mechanism. and they think it's going to solve it. They need to know it's not going to solve it. But also we scare them to death, putting them on all these medications. So let's find acute interventions like ketamine to address acute situations, like when your children want to hurt themselves. And let's break it and let's retrain their little minds so they can grow up and actually be the stars that they're going to be, because they need to understand how the hardware effectively works with the processing speed of their brain. It's like a computer. You got to upgrade the hardware. And you can do this, and your kids can do this. But we got to get it covered by insurance. Insurance needs to be covering these infusions for everyone. So if you're interested in this, you don't have the money. If you're interested in it and you want to help advocate, not only for yourselves, but for your kids and for your communities and for the future of everyone, reach out to your insurance company and tell them that you want this covered. Insurance companies will cover this if enough of their customers want it. So this is a great time to stand up for yourself, stand up for your kids, advocate for something bigger than you, so we can change the world one person at a time. So hang in there if you've got kids that are struggling, but look at ketamine infusions. We've been giving ketamine for over 53 years. We've been giving infusions for over 20 years. We use ketamine with C-sections, right? So ketamine actually crosses the placenta. So babies can get ketamine. Like, it's a medication that we utilize for C-sections. We give ketamine to pediatrics for anesthesia, but then also for blood draws. We give ketamine for cardiac cases because it helps to protect the heart. We give ketamine to our furry friends because it helps to make sure that their breathing and their heart rate and blood pressure don't decrease. And that's why you hear it in context of veterinary medicine a lot. We give ketamine in neurologic procedures like craniotomies that decrease the stimulation. So it's a drug that we've been around. It's been around for 5 decades and we're still questioning it. But the medications that are on TV, how long have they been around? How many people have they seen? So step back and change the context of how you're thinking about things and advocate for your kid. Don't look at the system. Look at the person first. The system will change when we start seeing how we can more effectively change lives and save lives. But until that happens, we're going to be stuck in the same system, the same rotations. We're going to be losing our kids every day. We're going to be blaming it on illness, not wellness. So your kids aren't ill. There's nothing wrong with your child. Your child's in a survival mode, trying to stay alive. And there's interventions out there to help your child. And that's what we need to work together to strive forward to create a better future for everyone. So should you have any questions, put them below. Comments, good, bad, ugly. Feel free to share this video if you want. But take a step back so we can look forward to change the communities for ourselves and our kids. Thank you for listening.